President and CEO of the Northeast Indiana Regional Partnership, and want to welcome you to the roadmap to a healthy reopening session. And this session, we're focusing on the education component. So we're really pleased to have so many education partners in Northeast Indiana join. I can see now we're at about 220 individuals online. So really appreciate everybody taking the time to learn and lead from what we can gather from the sessions and our professionals at Parkview Health. We are very appreciative of the support we receive from Parkview Health, Greater Fort Wayne, Inc., and particularly the Allen County Department of Health. A special shout out to Dr. McMahon and Mindy Waldron from the Department of Health for their great leadership through this pandemic from day one to today. They've been spending an awful lot of time making sure that we're keeping up to speed on what we need to know to keep safe, and now to consider how do we reopen this region's economy. And also a shout out to Heather Shagler at Parkview and the team at Greater Fort Wayne, Inc., and all the work that they've done to prepare these sessions. Just a great deal of time and energy over the last few days, including the weekends, to make sure these sessions are effective and we share good information that will help us get back to work and also help this region's economy work effectively and care for our children and educational requirements. As a matter of housekeeping, a couple items. If you would, please hold your questions towards the end. We'll have about the second half of the session devoted to answering questions. We really appreciate those people that registered online, shared some questions. That'll help us and help the Parkview team in particular have substantial responses to those questions. But you'll note there's a Q&A tab at the bottom of your screen. The chat feature will be turned off, but we'll take questions via the Q&A tab. So be alert to that when we get to that section of the presentation today. You will also be receiving a quick email immediately following the webinar to take any input or comments so that we can improve these sessions going forward. We can imagine that there'll be other sessions in the future responding to specific needs. So we want to make sure we get your feedback on how you receive this and anything that you learned. And also each participant will receive a copy of the slides and a link to the recording of the event, which is in progress as we speak. So thanks to all the participants for sharing your time and the presenters that are going to help us through this session today. I'm really pleased to introduce these partners from Parkview who are professionals and experts in the field that they're going to brief us on today. So Jo-Lynn Suko, Chief Innovation Officer from Parkview, Dr. Jeff Board, Chief Safety and Quality Officer, Dina Jackway, Chief Community and HR Officer, and finally, Dr. Mike Nip, Total Health Chief Medical Officer. So really grateful to have them with us today, and we look forward to having you hear your presentations as well as respond to questions. I'm going to turn it right over to Jo-Lynn.
Thanks, John. As John said, I have the privilege of serving as the Chief Innovation Officer for Parkview Health. And I want to start by saying thank you for all you have done for us as we've been there for you. Thank you for teaching our children online. Thank you for the dedication of your teachers, the creativity. Really thank you for staying home to slow the spread of COVID. We've been really overwhelmed by the generosity of our region. We've received hundreds of cards for coworkers and patients. We were moved by the flyover of the 122nd Fighter Week and the socially distanced prayer vigils held by the community in support of our team's response to this pandemic. And we've been really humbled by your generosity. So before we begin, I want to just share a little bit about how we're doing as a regional health system. So as you can see on this slide, our COVID impact meter, we're cautious, but we're not in crisis. And we're blessed in that we have not been in crisis as a health system since this began. We've been able to handle the surge, and we feel prepared into the future. Today, we're beginning to see the number of our hospitalized patients with COVID plateau. And in the last couple of weeks, we've begun to see more patients come back to our emergency rooms. We've also restarted some elective surgeries today. And I can tell you with the sun this weekend, I feel really hopeful. Really important that we start to see patients again, because we're starting to see patients who've held off on getting important care. And we anticipate a second surge of COVID, although we hope to manage that as a community. But we also don't want to see a surge of people who've let their care needs go. So, like I said, with the sun this weekend, we're incredibly hopeful. So, we, like you, are beginning to think about how we begin to safely open up the parts of our operations that we've suspended. And we're thinking about what that looks like in a world that is very different today than it was 60 days ago. As we think about this, there's some important considerations that will continue to guide our actions. So first, COVID is here, it's in the community, and we're going to continue to have positive cases. We know that the race for a vaccine is at least 12 to 18 months away, and we expect that it's going to be a little bumpy as we reopen Northeast Indiana and Parkview Health. We expect some resurgence, and we want to do everything that we can to keep those surges low. We're implementing a lot of safe practices to help our employees, customers, and our community. And we're operating in a world where the information is incredibly dynamic. And it may even be more dynamic in the education sector than it is in other sectors. Best practices are evolving on a daily basis. We know that crises like COVID challenge us to think differently, learn faster, innovate, and emerge stronger. So with that, so we've spent a lot of time, we've thought about how we can reopen safely, and we're thinking about all aspects of our operations. As the community has been so generous with us, today we'd like to return that generosity to you by sharing what we are learning and doing. Later in the webcast, you're going to hear a little bit about our free service offerings. But one thing that we've created is a website to share what we've learned and what others are doing in a variety of areas. This is going to be a living document that will evolve as this dynamic situation takes shape. We have it full of workplace considerations and people considerations. And we've also established a hotline with one-day turnaround where you can get your questions answered by our subject matter experts. We want to stay in dialogue with you, our community, so that we can all open safely together. With that, I will turn it over to Dr. Jeff Ford, who will share more about our approaches to how we keep our workplaces safe.
Hello, everyone. So, as Jolyn mentioned, we are in an unprecedented time, and in the education community in particular, there are a lot of unknowns. So we recognize that we don't have all of the answers for you right now, but we do want to share with you what some of our best guidance is based on our experience, subject matter experts, and other resources that we've identified that have provided a helpful framework to build a safety plan for your organization. So when we think about place, we want you to think about your built environment and the spaces that in the education world that your staff, your faculty, that your students and visitors interact. You may have aggregate spaces like gymnasiums or auditoriums. You may have classrooms. You may have workspaces where you have people working at individual workstations. You may also have public areas or areas that you might share with another organization or business, such as places where you have a single building where you may have an education establishment and other businesses with a common lobby area, for example. So the recovery plan needs to consider our current community status of COVID-19. Right now, we are in what is called community spread. This means that the source of infection for any given individual cannot be pinpointed. So if we see a patient in the clinic or hospital, we generally are not going to be able to reliably identify where did they actually acquire the virus, because there are cases of it in the community. Everyone in the community has the same risk of acquiring COVID-19 because it's a novel coronavirus and that there is no established immunity. However, even though we all have an equal probability of contracting the illness, the risk of severe illness is different across different members of the population. So in particular, older adults, those 60 years of age and older, and also those that have chronic medical conditions are more susceptible to severe illness if they do contract COVID-19 and may be more likely to require hospitalization or even ICU level care if they become sick. A fundamental framework from occupational health and safety is something called the hierarchy of controls. And this is really the framework that we encourage you to use as you build your safety plan for your organization, for your educational program. On the top of the hierarchy, the most effective is to eliminate the risk. So this is removing the hazard from the student or the employee. Next, it comes down to engineering controls. This is isolating people from the hazard. And then below that are administrative controls, which is the way we operate, changing the way people work and interact to mitigate risk of transmission. And then finally, the last line of defense is personal protective equipment, or PPE. It's important to understand that PPE is not the first thing we should go to, but something that we look at all of the different levels of hierarchy of controls before we look at employing personal protective equipment. It's important to, if you're going to be using personal protective equipment, assure that whoever is using it has received proper training on selection of PPE and also appropriately donning and doffing, or putting on and taking off personal protective equipment. The CDC recommends that all businesses consider their engineering controls and look at things, for example, like traffic in your building, ventilation systems, and other opportunities. It's also important to think about those various administrative controls. How do you support respiratory etiquette and hand hygiene among your staff, your students, your faculty members, so that you minimize the risk of spread in group settings? I want to spend a little bit of time talking about testing. This has received a lot of attention in the media, and given the calls for testing and the many different programs, this can be a confusing subject. First thing I want to talk about is antibody testing. This is done through a blood sample, and it does have utility to help with what we call population surveillance studies, looking at identifying across a group of individuals in a geographic area what has been the prevalence of past infection. This is currently being done by the Indiana State Department of Health that recently launched an antibody testing population surveillance program in collaboration with the Indiana University School of Public Health. In that program, they are systematically sampling residents of every county in the state, and they plan to repeat that blood testing of a random sample of the population of each county at regular intervals over a 12-month cycle. And this will give us a much clearer picture of what the spread of COVID-19 has been in various communities and regions. This can help inform policy and also help with assessment of public health interventions. However, there are some very important limitations to antibody testing currently. Right now, medical science does not know that whether or not antibodies are in fact protective, and if so, for how long. Coronavirus, SARS-CoV-2, the novel coronavirus that causes COVID-19, we just do not have enough medical science information to really understand whether or not past infection actually, the immune response, whether or not it results in lasting immunity in humans. So at this point, we do not know that whether or not having an antibody titer would mean that you could or could not be susceptible to reinfection. We also do not know if an antibody titer would mitigate the risk of passing the virus on to others. Furthermore, the FDA, in an effort to rapidly get as many testing opportunities to market as quickly as possible, waived the standard requirements for regulatory evaluation and approval for diagnostic tests for COVID-19 antibodies. As a result, there are literally over 100 different tests that are currently marketed, most of which have not had any formal evaluation or scrutiny by the Food and Drug Administration and have not undergone any sort of large systemic validation by a clinical reference laboratory. As a result, many tests on the market, unfortunately, are inaccurate or unreliable. Therefore, using antibody tests are really at this time not appropriate for return to work or return to school decisions. Next, I want to talk about PCR testing. This is the nasal or nasopharyngeal swab that we use to diagnose active infection in people with symptoms. It's important to recognize that this swab, the PCR test, it's basically detecting the RNA of the virus in the back of the throat. So if people are not yet symptomatic, they may not be shedding enough virus to detect using this method. This means that a significant proportion of people, if they don't have symptoms, may actually have a false negative PCR test, but can then later develop symptoms and be diagnosed with COVID-19. The other thing to remember is that the PCR test is a single snapshot in time. It only tells us that whether or not you have detectable virus RNA in the back of the throat at the time the swab is collected. A person can have a negative PCR swab on Monday, be exposed to the virus, and be infectious later that same week. So at Parkview Health, we have used the hierarchy of controls, and we call it more than a mask. I want to provide some brief examples of how we've applied the hierarchy of controls in our health system. So first off is elimination. So we have eliminated risk of transmission, for example, for patients and coworkers by embracing virtual health. So in the prior week, we completed over 6,000 virtual health visits by phone or by direct video link. This eliminates the risk of infection to the vulnerable patient populations, also eliminates risk of infection to coworkers. We've also transitioned to a majority of having virtual meetings, which also helps eliminate risk by physically removing people from the hazard of transmission. Next are engineering controls. We use things like negative airflow, isolation rooms in the hospital setting, physical barriers to separate coworkers and individuals to prevent risk of transmission, as well as other engineering steps to mitigate risk. Administration controls include things such as visual cues to help people maintain appropriate social distancing, reordering a waiting room so that you remove chairs so that people will sit at least 6 feet apart, having hand hygiene materials available such as hand sanitizer, things to support respiratory etiquette, etc. And finally, PPE or personal protective equipment. We make sure that we train our coworkers and provide the right kind of PPE based on the type of hazard and the type of work that they are doing, and also make sure that they are properly trained on how to select, don, and doff their PPE appropriately. With that, I'm going to turn things over to Dina Jackway, our Chief Community and Human Resources Officer.
Thank you, Dr. Board. So as Dr. Board just walked through kind of how to keep our workplace safe, I mean, I even think about the room that we're in right now doing this webinar. So we're all 6 feet apart. We all have our own hand sanitizer. We're making sure that as each of us are coming up, we're making sure before and after we're keeping ourselves safe with the sanitizer and Kleenex. So it's a way for us to rethink even how to put on today's webinar. So now shifting from workplace, I'd like to shift to really the people. And we know that people are the most valuable resource that we have. And in particular for your organizations, not only are those of your faculty members, but your students and those other organizations that you're working with or who might be on your education campuses, the community at large, and most certainly parents of the students as well. So when we think about people today, it's really this broad group of individuals. When we look at a preparedness plan, one of the best things that the CDC really puts out is having that workplace coordinator, having someone that is responsible to be the single source of truth, again, for your faculty and for your students, and being able to, so here at Parkview, we have an incident command center. We put out very purposeful and thoughtful communications to not only our coworkers, but to our leaders. And so when we think about in your organizations, how to make sure you're putting out information to students, to parents, to the faculty, to everyone that is going to be on your campus, and making sure you know they're getting information from national news, from local news, social media. And so you have the ability to control the information of what they need to know when they're stepping foot on the campus or they're engaging with your campus. So that really is important. And some of you may not have HR departments to do that, but think about who are the key people in your organization to really lead that effort. When you educate, and I'm looking at it from the workplace standpoint right now, educating your faculty and those that work for the education institution on what they can be doing and how they can help support the spread and not spreading, and making sure they're setting up social distancing appropriately, making sure that we have all of the appropriate practices and guidelines in place to protect everyone. That is really at the top of the list, because everyone has a lot of fears. Students coming back onto campus, and most certainly parents sending their children to school, wanting to make sure that we're keeping them safe. So education is really important, but not just about the what. Explain the why, because many times that's that other piece of information that if we just share both the what you're asking them to do, but why, really helps alleviate some of the fears. Consider your social distancing practices and guidelines, and consider those vulnerable. So you may have some faculty members that are more vulnerable than others, whether that be by just simply age or whether it be underlying health conditions that they may have. And so as you consider the work that they may be doing for your education institution, you have to determine where can you possibly accommodate them. No different than accommodating students that might have underlying health conditions, and what process you may have them go through. So be thinking about how to be creative and accommodating, and above all, make sure there is at least a process for someone who needs an accommodation to raise their hand, and a process that they'll go through so that you can evaluate what you can accommodate. Also on the preparedness plan, I think flexibility is word of the day. We've all had to be very flexible, and one local CEO I thought put it really well. He's a CEO of a manufacturing organization, and he said, it feels like I'm flying a plane but trying to fix it at the same time. And it's just realizing that you need to be so flexible right now, and policies that perhaps you thought you'd never change or that always had to be a certain way, you need to flex and find new ways, because you're not only asking your faculty to maybe do things a little different, you might have them, especially if you're all coming back into physical institutions, you might have people who are responsible for not only teaching a class, but making sure that all of the surfaces are cleaned. You're asking them to do some things a little different than before. And because we're asking flexibility of the faculty, in turn, you're gonna need to be flexible with them, because some may or may not need accommodations because they have their own families and their children are at home and they don't have childcare, or there could be a number of barriers to why they're not able to do the exact same hours that they once did. And so how can we be as flexible as possible and obviously still meet all the needs that you have as an education institution? When you think about the phased return of individuals, so a short example here at Parkview, we, up until about 60 days ago, we didn't have a lot of our individuals working from home. And very quickly, we had about 4,500 of our 13,000 who are now working from home. And we did it very quickly, and we recognized it wasn't perfect, but we had to get everyone working from home that could. And so we also know that bringing them back into the organization is not going to happen with all 4,500 coming back at once. It's going to have to be phased over a period of time, which could frankly be 12 to 18 months. So how are we going to make sure, particularly for your education institutions, to bring people back? And it may not be all at once. You may be able to virtually do some of these classes as opposed to having in classroom. And obviously we don't have all the guidance we need right now because that'll be coming hopefully in July from the governor to add clarity to his responses from last week. I think we all would agree that as we have had to change our processes and our approaches to work, there have been some really good things. Every industry that we've done these webinars for, there's best practices that have emerged that we say, hey, that might be something to carry on into the new normal, something that really works. It meets the needs of the customers, or in this case, the students, and it meets the needs of the education institution or organization. So what are you going to carry forward that's worked really well into the new normal? Just make a quick comment. It's less about the content on this slide, but the point we're trying to make here is because you are an employer and you have faculty and staff, it's really important that you have a process where you have individuals who have been sick or their family members have been ill and how they come back into your organization and how we know they're safe to come back into the organization. And so this return to work process is really important because you want to not only keep your students safe, but obviously anyone who's coming onto your campuses, including those that you are instructing and your own faculty and coworkers. So making sure you have a process is really important to bring them back. And lastly, just a slide on what Parkview is doing. And there's so many things that we're doing, and we're certainly happy to go into this in more detail with any of you individually. But we found a few best practices, the first of which we simply asked our coworkers what they needed. Now, it sounds really simple, but one of the most powerful things that we have is the voice of our coworkers and the voice of our customers and the voice of our patients and visitors. And so we simply asked them, what are the barriers? What are causing some of your fears to come back into the organization or coming back into work? And by answering that call, by what we're hearing, we're able to address some of their concerns. So asking individuals, which will help provide the right answers that you need to give them the best resources back. We flexed a lot of benefits. We flexed, our PTO, leave of absence policy, attendance policy. I mean, I could go on and on, but the idea was we flexed the benefits to give the coworkers the most opportunity to use those benefits and certainly continue their pay. And caring for mental health, we think that that is very important. Right now, everyone has a lot of fears and a lot of unknowns, and everyone is experiencing it very differently. So one size cannot fit all. And we did find that there were a few simple things that we could do, whether it's expanded EAP services or virtual support groups for coworkers, or even the Calm app, just an app on Android or Apple that they could tap into as a coworker for free and help them with anxiety or breathing techniques or helping them sleep. That really helped many, not only coworkers, but their families. And then finally, when we talk about asking for feedback, families are really important because we all know that families are going to heavily influence as students are coming back into school. And so we want to make sure we understand from a family's perspective what is going to help them feel safe when they're sending their children to school. And communication cannot underscore how important that is, and being able to explain the why. So now I'm going to turn it over to Dr. Nip.
Thanks, Tina. Hi, it's Dr. Nip here, just for a couple insights from the occupational medicine world. So what you're going to see here on this slide, there's a lot of content there on the right. This is an example of what CDC has brought together for education. But I would want you to focus here on the left, things that are in orange. Real quick, I'm going to call it a couple things. I'm going to be echoing some things people said before, but just to put a fine point on it, wherever you end up finding your solution on the hierarchy, you want to try and make that optimal, safe, and healthy choice as automatic and as easy as you can for the employees and students and whoever else might be interacting in your community-facing space. The second point I wanted to bring up was looking within, like Adina just mentioned, the innovations could come from you know, a student, a parent, anybody who has a good idea, it might be worth giving it a try. The seventh grader may untie the Gordian knot, but figures out how do you continue a certain activity or service in your school. The third thing to bring up again is to be very open and communicate with parents and parents of students and the community. I myself, I've gotten very nice emails from the administration of our school court regarding planning ahead, what's going on, and just being very open with what you're doing to increase and optimize the health and the safety of the students in the school environment. So here's a slide from the Toyota document on how they're getting back to work. I just want to call it a couple things for the point of there's lots of spaces to think about. Dr. Board talked about some of the bigger ones, literally and figuratively, but also some of the ones you may not think about. One of my near and dear up in the upper left is the coffee maker. So it's just trying to find a plan for each space. How do you need to approach these so-called high-touch surfaces that a lot of people are going to be coming in contact with? Over under vending machines, as you can see there, sometimes the answer might be to eliminate something, but if you can, as the document states, you want to try and find the next most optimal solution. One other slide here on some more surfaces regarding bathrooms, because these are definitely something you have to think about. Just for example, I want to bring up a solution, bringing the trash can even closer to the door of the bathroom so the child or student or employee can wash their hands, have the paper towel, use the paper towel to contact that high-touch door handle, and then throw away the paper towel as they're exiting the room, avoiding having touched the high-touch handle. Real quick here, we're not going to stay long because this will be on the website that Jolene in a second is going to talk about. But for example, here's from the CDC, as you can see, bottom right, is a decision strategy for schools and how to make some decisions based on your specific situation. As you can see there, regardless of spread, and there's a section on no community spread, and then if there's a little bit more. So again, this will be on the website. We're going to talk a little bit more about in your specific sector. Again, one more slide that just highlights a couple of other decision frameworks and just some good information for you to have in your toolbox. And then finally, when you do get to our website, there will be an education where we've basically, and our intent was to get the best of the best for you to have tools that will either start your process, continue your process, or finish up and get you across the goal line, knowing that each solution or problem you're trying to work on may be at a different stage, but this is a good place to start to see what's already been done out there. I'm going to turn it over to Jolene, but first, in honor of today's date, I just want to offer, may the 4th be with you.
Thanks, Dr. Nip. So we're here to help. As I mentioned in my earlier comments, we've launched Parkview Business Connect, and this is coaching for a safe phased approach to reopen your business or school. So as we continue to operate in a pandemic, Parkview wants to help leaders to lead. So what you think of as healthcare, we're also the largest employer in the region. We operate 10 cafeterias, a police force, have an extensive grounds crew, office areas and frontline areas, and a team of educators and a simulation lab. So we're learning every day in all of these areas. The dynamics of this pandemic are changing rapidly, which means that our responses will evolve and change as well. You've heard a little bit about our website. We've launched a website where we're trying to curate the best of the best. We have a lot of our best practices and policies on there. You can access helpful resources aimed at keeping people well and creating safe workplaces. You can also connect with our subject matter experts by clicking on the bottom at the right, and we'll get back to you in a day. This is free, and the service is free. We're really excited about this, and it's going to evolve as the needs of the region emerge. So please share with us your ideas for future education topics or webinars, or even where you're stuck. Here is the number you can call, 260-CONNECT, and I think this is going to be up during the Q&A. We want to help you, and we want to open safely together. So with that, I'm going to turn it back to John for Q&A.
Thank you, Jolynn, and thank you to all the presenters who've gotten us started on this. The presentation material is invaluable, and what a generous offer of Parkview to lean in to assist wherever they can by, if you make contacts with the website, and that will be posted throughout this session. So we do have, again, I mentioned earlier that we have some questions that were fed to us in advance through when you registered. And so we're going to focus on those initially. And then a reminder, the Q&A session is open at the bottom of your Zoom platform. And so you can submit that way, and we'll watch for questions there and try to call out some. If you, for some reason, we don't get to one of your questions, forgive us for that, just based on the timing that we have available today and to respect your time. But you can also enter questions on the Parkview website where you'll see the website information. So we're going to start going through some of these questions we got in advance. So this is the first question we put up. And that some of these questions were picked based on the substance and also the repetition that might have shown up in the advanced questions. The governor has said schools will receive direction on the fall start by July 4th. If schools are allowed to begin in person in the fall, should we? And if we choose to, what do we prepare for? Socially distanced, masks, return to e-learning potential? That's the first question.
This is Dr. Board. I'll start with that. So this really comes back to the fact that we still have a lot of uncertainty about how are things going to look in a few months. And we are going to have to await further guidance, obviously, from the governor and from other educational agencies at the state community level. But I think the time to begin planning is now. And even though we don't know precisely what the future is going to look like as the fall school year kicks off, you really cannot start planning too soon. So obviously following state and local guidance, but looking at if things were highly favorable, how would I open my educational program in the fall? If I have students, if I have residence halls, what does that look like? Am I going to be housing them at the same density that I would normally? What types of measures would we want to have in place? And then also having sort of a tiered and flexible plan. So if there was a resurgence of cases and you needed to return to e-learning in some or remote learning in some form or fashion, do you know how you would do that, and what would you want to have in place so that you could be able to manage quickly transitioning to that if the conditions regarding COVID-19 in the community warranted that? I think at the very minimum, things are going to look different. There is a new normal. We are coexisting with COVID-19 for the foreseeable future, or at least 12 to 18 months out from a vaccine, and therefore social distancing, hand hygiene, cleaning surfaces, limiting certain types of activities and events is just going to be a reality in education as it is in other sectors of the economy.
It's Dr. Knipp. I agree completely with Dr. Board. I think what we've been trying to talk with different sectors are, you know, it's the marathon, not a sprint language, to say what is a strategy you could possibly implement for the next 18 months to know, even if there is more restriction, of course it affects you, but you're already kind of have it built in. The example I'm kind of bringing up is I've even seen some things where they would, you know, Monday, Wednesday, first Friday, it might be grades 1, 2, 3 that are physically in the school. Tuesday, Thursday on the off swing are the other group of students. So it's already engineered in. If there's a pullback, that you have something set up where you can do a mix of remote, just something that's going to be workable and sustainable for 12 to 18 months. And then, as Dina mentioned, something you figured out that you may want to keep from now on, that would work then and would work in the future.
Thank you. The next question, very important one. It gets to the heart of the matter in some of these cases. How do we care for the social, emotional well-being of our staff and students as they return to school? We recognize that there may be many fears.
Yeah, so this is Dina. I think that it's really important because as I said earlier, one size is not going to fit all. So having a variety and a mixture of ways that you're going to be able to be supportive is important. So utilizing the expertise of guidance counselors or student health professionals, the team members within each of your institutions that are going to be able to help connect. Some faculty have just naturally great connections with some students. How do you tap into them and get an idea of how they're feeling, and what are the things that they can then bubble up to you as administrators of what's needed? How do we establish regular check-ins and having, particularly if we are all together or a subset together on campus versus online, how do you establish check-ins on a regular basis so that you are getting information about how people are feeling or barriers that they may be having? And being able to then connect with Parkview. I mean, as Jolynn outlined, we have the Business Connect resources. It's not going to go away in the next couple of months when you're deep in the trenches of trying to work through these things. And so we want to help be a partner and a thought partner with you along the way.
Thank you. Next question that we're confronting. What are the key elements we need to include in our preparedness plan in order to ensure safety for every student and every staff member?
Well, this really goes back to the hierarchy of controls and really having a multifaceted approach, and one that you clearly and consistently communicate with your staff, your faculty, your students, and parents as appropriate. As Dina mentioned earlier, one of the big advantages we recognize from having an incident command center is that allows us to develop and rapidly disseminate on a daily basis communication regarding our safety plan and our response to COVID-19. And early and consistent communication about things such as key behaviors, changes in practices around various things in the school environment. So how people queue up to go into the classroom, attention to hand hygiene. What's the process by which a student who feels ill, how do they call in sick? How do you make sure that that process is appropriate and flexible so that you don't have ill people coming to school because they're worried about consequences, but potentially putting others at risk? Same thing for your employees and faculty. Do you have a comprehensive, flexible, and easy to initiate process if you have somebody who may be ill? So the other thing is just the new normal of cleaning one's own workspace and engaging students in that activity. You don't have environmental services or janitorial staff large enough to clean all the surfaces and count on them to do everything in addition to your routine cleaning. So this is something where everybody, it has to be a broad-based effort, has to pitch in and clean. When I come into the Incident Command Center, I've got cleanser there, and at the beginning of my shift, I can wipe down my workspace. I do it at the end of my shift so that I help out, right? We can't just rely on our EPS workers to constantly police all those high-touch areas. So I think the key is really communicating that comprehensive approach, highlight all of the things that you're doing to maintain a safe work environment, including things like having virtual meetings or doing some remote learning, physical distancing, sick day rules, etc.
Next question. How do we keep students socially distanced in a childcare center, K through 12 school or university settings?
This is very challenging because schools were not designed to have 6 feet of separation between every student, at least no school that I ever attended. And I spent a lot of time in school. And so this is a challenge. So we have to really think creatively, and in the places where it's not, from a physical building standpoint, tenable to socially distance, then you have to think about other controls. So meticulous hand hygiene, could there be a role for cloth masks or face coverings when you really can't maintain that social distance in a classroom setting? This may be where you need to think about that bottom tier of hierarchy of controls that includes masking or what we call source control. So when we talk about cloth masks and say, out in public or in a workplace, it means the reason I'm wearing the mask is to keep my coughs and sneezes from infecting those around me. So it's a little bit different purpose, and it's only effective if everybody's really doing it. So it's something you have to have a consistent policy around. Keeping a mask on a very young child is frankly not tenable, at least not with my children when they were growing up. But for children above a certain age, and certainly high schoolers and college age students, having a masking policy is certainly tenable. But you have to decide, how are you going to do that? How do you make sure that they have a mask and give them clear guidance on wearing it, having a clean mask each day, etc. So really thinking about that, as well as telling people on a daily basis, if you have these symptoms or if you have a fever, you need to stay home, you need to call in and get instructions.
This is Dr. If I just wanted to add, I'm sorry, John, I agree with Dr. Board. I've really struggled with this point. Both my folks were educators, and the classrooms are not big enough. There's, 50 million kids in the room. It's hard you want to engineer in the same educational experience for each kid, but putting that on top of wanting to socially distance, it gets very tough, like Dr. Board said. So it's, can you find a different rung of the hierarchy, or is it you're using the same space differently? Again, do you have, this is an e-learning week for these grades, and then this is an in-person week for the other grades, and you're spreading out the same amount of half the students amongst all the classrooms each time, where you can get, you can kind of hit that social distance metric. But these are things I think are going to have to get figured out. And I think the underlying theme is everyone's trying to meet these the best they can. Masks can be a strategy, but I think we were talking, are they going to end up on the floor of the bus or the gym or something, walking in, and then kind of hasn't done what it's supposed to do. But I think it's trying to meet the students where they are and try to come up with the best solution.
Very important. I'm going to go to one question that's on the Q&A list right now, and we've heard this one before, so I think this is an important one to answer for the educational institutions as well. Are organizations using thermometers or thermal scanners with their employees? If so, how and where are they sourcing the equipment?
Great question. So something to think about. On the surface, it seems like temperature monitoring is a very easy, straightforward thing to do, but there's a lot of important caveats and implications of a temperature monitoring strategy. So first off, with COVID-19 illness, we know this both from our clinical experience at Parkview and from published medical literature, as many as 40 to 50% of patients who present with COVID-19 do not have a fever at the time they present to the doctor or to the emergency department. So although fever can happen at some point in the course of the illness, it is not universally present at the time people start to become ill. So people can become ill, they can be infectious and not have a fever that morning when they come into work or school. And so temperature monitoring in and of itself just does not have the sensitivity to be able to effectively screen out all of those who might be sick and can transmit illness to others. The other thing is getting, temperature monitoring. If you're going to be in close proximity to do temperature screening, that means the person doing the screening would have to wear personal protective equipment. So that has to be sourced. The person has to be trained. The contactless, temperature scanners that you might see, say at a hardware or DIY store, they are not precise enough to really use effectively. They have a variation or fudge factor of plus or minus 2 degrees Fahrenheit, which means that if somebody has a temperature of 101, they can read at 98 or 99, and you're not going to be able to catch them. There's some other considerations as well if you're going to be screening employees in particular that I'm going to turn over to Dr. Neff.
Sure. Thanks, Dr. Board. So the EEOC a month or so ago did come out and say this medical examination, which a temperature check is, could be done now that the WHO has called this a pandemic. The issue is here, that's a protected piece of health information. You have to acquire it, store it with the same amount of protection as you would someone who's hospitalized for whatever, you know, either virtually on a spreadsheet, or do you have on a piece of paper? Is that under lock and key? Who gets to know what it is, and who makes the decision based on that every time it happens? Has to apply equally, whether it's the principal or the university president, or it's a teacher first day on the job, or just a substitute coming in to work for the day. If you're going to make a work-related decision about it, you need to keep it protected the same way. The other, I think, facet to come into play too is, and I'm guilty as charged, put some kids ibuprofen and sent, you know, my kid off to school, you know, because, you know, are you going to check every kid's temperature every day? What happens? Who does that? Or is that allowed? I think legal counsel would need to know, can you mandate? How do you get it up and running mandated to do that? Plus, back to the employers or employees, making your sick policy flexible so they're not trying to quote unquote beat the scanner. You know, slamming the Mountain Dew or taking an ibuprofen.
If we go to the next slide question, I also believe that there is a question in the Q&A queue that this will relate to as well. The question on the slide is, how many students can we put in a classroom while maintaining social distancing? And that's probably cast in the characterization. The governor's opening economy stages obviously change the number of size of group settings that we can gather together in over time. So maybe this is a good one to start from an educational perspective on classroom sizes and maintaining social distancing.
So it really goes back to looking at your context. So how many students do you have? What's the configuration of the room? How many, you know, can you really spread students out? I mean, one of the things is that, as Dr. Nitt mentioned, is there a way to distribute the learning time over a broader time span so that you can have fewer students per classroom? And that's going to require some very non-traditional, out-of-the-box thinking in terms of education delivery, and it has a lot of impact. It impacts curriculum planning, schedules, etc. You know, do you have something where you have a somewhat longer school day, but you don't have all the students there the whole time, so that you can stagger when they come on and go off campus, and that way you can maximize the spread with the available square footage that you have in your building. So there's a number of ways. I don't have any, you know, magic easy techniques. It's something that's going to require a lot of innovative thinking, and it needs to be customized, obviously, to the size of your student body and the available classroom space that you have to work with.
Next question we had prepared in advance was, how should we be cleaning in classrooms, cafeterias, athletic facilities, and other common areas?
Sure, great question. So what's been helpful is the FDA has put out a list of approved cleaners. And then what's the schedule for cleaning certain areas? If it's a classroom used once every week, obviously that's different than a restroom or perhaps a locker room or something. And here's a slide that just came up that is also very helpful to give some input on that. And that also will be, you can find that if you come and land on the Education Business Connect section, so you don't have to reinvent the wheel. There's already some guidance out there of what to use and how often to clean and that sort of thing.
The good news is that SARS-CoV-2, the virus that causes COVID-19, is not a difficult virus to kill in the environment. It is not a hardy virus. You know, all of kind of the standard approved cleaners for the most part are going to be very effective. So you really don't need to really generally require extraordinary or different cleaning agents probably than you're already using. And all you have to do is just validate that you've got a good cleaning process and you're adhering to using agents and being systematic about your cleaning processes.
Okay, so there's this question also goes to one that we received in the Q&A by Bill Cada. So this is an important one to dig into a little bit. Can we safely offer gym classes or sports? Maybe even some of the summer programs should be considered. If yes, how should we be cleaning? And can we screen athletes prior to participating to ensure no illness?
I have a couple. I mean, I think for Lee's, Indiana, I'm going to mess it up. The Athletic Association, whatever that acronym, I'm sorry, they may have some guidance to say what you can and can't offer. Obviously, if you're playing basketball, it's going to be hard to maintain a 6-foot social distance if you want to potentially not lose the game or whatever. But I think it's, again, trying to do the best you can. Masking during athletic activity, I've seen that question come up a lot because, you know, usually these masks, when you're just kind of doing normal sitting activity, there's not a large increase of physiologic demand. But if you're running up and down, obviously that could change. You know, like we have on here, there's always been the possibility of a communicable disease, you know, running through a team where one person gets the flu, they share a locker room, practice equipment, and they do that. So again, it's reiterating that the cleaning as best you can, kind of going on the system with the parent saying, you know, you shouldn't play ill, the coach say you couldn't play ill. I know it might mean that maybe the star player is not on the court or the field, but really for the greater good, that's going to be a decision each team needs to make for itself. Like as we said, again, temperature screens are ineffective. Again, with the dividing the same amount of kids across the same space, perhaps some are in the gym, some are learning about other aspects of sports at the same time, which is kind of gym adjacent. I know my kids right now with e-learning are learning about history of whatever sport it is, so you can kind of mix and match. Just it's a tough question to ask, and you just try to do the best you can with the different strategies.
Yeah, the other thing is the type of sport you're talking about. There are going to be some sports that are going to really lend themselves well to maintaining social distancing. So, you know, cross country, tennis, these types of things where people are not close together are much easier to modify, you know, or require minimal modification. Wrestling, football, close contact sports, very difficult to ensure that. And so, you know, you can't socially distance, you know, with some sports like you can with others. So that's yet another consideration.
Next prepared question, are there any HVAC or indoor air quality considerations that we should consider?
Hi, this is Anna Below, Director of Safety. Just wanted a couple of things on this. One of the things I first and foremost want to mention, there's been some questions about fans or use of fans in the classroom, and we really would like to discourage that practice only because for obvious reasons it might blow the particulates around the room and further the spread. But when we talk about indoor air quality, one of the things that is a good possibility or a good option if we're looking for additional protection is the purchase of an indoor air an indoor air purifying device. So many of them have HEPA filters in them of varying levels, and I think the thing we really want to make sure that we're taking into consideration if we're exploring that option is making sure you have the right type and size for the room. So depending on the number of students you have in the classroom and the square footage of that classroom will really go into play when you're selecting the right device. And then just making sure that you're vetting that properly and making sure you have good utilization and you're making sure that things are being changed out on a frequent cadence. You can also look at working with your facilities team. Sometimes there's options of increasing the number of air exchanges in a classroom. So those are some options that you could look into. Certainly when you're considering the different air quality concerns.
Really good points there. Thank you. The next question, and we're at 2 o'clock, but there's only 2 or 3 more prepared questions. So for those of you that don't have to leave right away, it may be worthwhile to hang in there for a couple more questions here. Schools offer some unique considerations that aren't necessarily found in other industries. Could you address how to offer the following aspects safely? For example, bus transportation, recesses and playgrounds, one of my favorites. Hands-on learning and shared materials like libraries. What can we do in those areas?
Well, Dr. Nip and I will try to tag team this. So transportation is really challenging because, you know, if you're a school district, you don't want to have a lot more buses than you really need because they're, you know, costly to operate and coordinate. And so you've got kids that may be going to more than one building on the same bus. Depending on where you are on the route, how many kids you're picking up, the bus may be fairly full. So these are things that are going to require a lot of thought. So, you know, how long is the route? How many kids are on the bus at any given time? So that could they spread out on the bus, and what other measures might be encouraged, such as having them, you know, get some hand sanitizer when they board the bus, or other measures, you know, wiping down the bus at regular intervals. So there are some various things that you can do that I fully recognize this can be very tricky, particularly for school districts that have a relatively small bus fleet that goes and services multiple education, you know, multiple schools.
I would agree with that. I think it's additionally a challenge when you have transportation situations where you have a bus aide who's helping children with special needs or something like that. You know, you're just trying to, you can't clean everything. That's incompatible, I think, with keeping the transportation going. It's maybe identify your high touch areas. Is it the handle everybody touches when they get on and off? That's where a lot of bang for your butt goes. Have the school bus driver clean down the wheel, and then just try to clean what you can. But I agree with Dr. Board. The answer can't be more buses for the same amount of kids. Some of the other ones, recess, playground. I mean, I think what I've talked to with other folks is the last stop on the train before touching your face, make sure those hands are clean. So it's, you know, line up to come in from recess. Everybody gets a squirt of hand sanitizer. You make it easy and automatic for the kiddos because it's right there by the door, and the teacher or the teacher's aide can go ahead and get that done. Kind of the same thing with maybe in general, but hands-on learning in labs as well. Just making sure hands are clean before, right before and at the end. Wipe down what you can, high touch. If there was a model that was used, maybe wipe that down. There's a lot of scientific discussion. How long does it live on surfaces? A lot of those studies have been done on hospital-based surfaces to mimic like a hospital counter or a bed or something like that. It's longer than a few seconds, but with the approved cleaners, like Dr. Bohr was talking, it's fairly manageable to knock this thing out. Same idea, library. You can't wipe down every book, but control what you can control. If someone's checking out the books, maybe wipe down the books because you know they were clean going out, or clean when they come back in. Hand sanitizer for the kiddos as they're leaving and entering. Same thing for the librarian. You're not going to be able to clean every surface every time and drive virus to 0% anywhere, but we want to get it as reduced as we can. That's what the strategies are trying to do.
Yeah, the other thing in libraries is, you know, what are some simple changes that you can make? So, for example, if you have, you know, reading tables, removing some of the chairs, spacing them out, you may want to eliminate certain things like magazines, right? So those are, people pick them up, put them down, pick them up, put them down. So some of those high touch things, or when you have books out that get a lot of handling, you may want to remove some of that. You may want to also emphasize more online resources. So the good news is that there's a lot of content now that's digital, and children may be able to access using their personal electronic device, which mitigates the risk of you know, common surfaces. So those are some other opportunities as well.
Next question. I think this is second to last here, but this one's a good one. And I've not seen this one before, but should we be considering a quarantine classroom for those students who are self-monitoring for potential illness so they can continue to participate in the learning experience? If yes, what should we prepare for in that space that may be additional measures beyond the traditional dorm or classroom?
It's an interesting idea. I would say, you know, I would be thoughtful about, you have to make sure you're distinguishing, you know, people who actually have symptoms that are in isolation versus those maybe that just had an exposure, meaning that, let's say I'm a high school student and my mother or father has been diagnosed with COVID-19. I've been exposed, but I'm not symptomatic. So, you know, if you have people that are exposed, that's different than people who are symptomatic. Generally, if people are symptomatic, we really would not want them in the classroom if at all possible. It's interesting to think about exposures. You know, generally speaking, with contact investigations, the vast majority of people that we see exposed, at least based on our experience in healthcare, the vast majority of them do not develop symptoms. So majority of those people are going to go through a period of time where they may be self-isolating, but after that, you know, 10 to 14 day period, depending on when the exposure was, elapses, they may never become sick, in which case they can return to normal duties. So it's an interesting concept. We'd have to think a little bit about how you would operationalize that, but it is interesting.
So we want to emphasize again, we've come to the end of the prepared questions and we're a bit over time. One more reminder on the Parkview Business Connect. The phone number there, where to reach out, how to go via the website. Very important that we take full advantage of what Parkview has learned and how they're going to lead in giving back to the community here. We're so grateful for their willingness to do this and access information that can help all the different sectors that we've covered over the last week. I want to give a special shout out again. This is actually session number 9 in a series, 1 regional one and 8 segment or sector ones. And Parkview has given again and again by tailoring each one of these principles and best practices to the sector and the spaces that we have to do business in or go to work in terms of education. So really appreciate all the time they've given to this. Special shout out to the partners, Parkview Health, but also Greater Fort Wayne, Inc., the Allen County Department of Health, and the team members at the regional partnership. Everybody participating to make sure this was successful. I suspect this is not at the end. I suspect there's going to be a lot more learning that we need to do and sharing information. So stay tuned for notices of future sessions that we plan to be holding. If your question was not answered today, be sure you reach out. Parkview has offered to answer other questions on their website. We are all here to help get this region's economy, get the state's economy, get the national economy going again at full tilt. But we've got to be patient, and we've got to do it in a way that respects the safety and health of our students and all the employees that make these things happen and happen well. So thank you for attending today, and we hope you can enjoy another fine spring day in Indiana. Take care.